So what if every single decision in healthcare, I mean, everything from the treatments you get to how a whole hospital runs, was based purely on the best available facts?
Sounds pretty good, right? Almost ideal.
Well, this isn't just wishful thinking. It's the main idea behind evidence-based healthcare, EBH for short. It was forcefully spelled out by Cochrane way back in the early 70s, but it properly exploded in the 1990s. Now it's fundamental for doctors, nurses, clinicians everywhere. And it's even spread out, into social care, criminal justice, education.
Yeah, it's huge. But what's really fascinating, I think, is this paradox.
Paradox.
Well, yeah.
Yeah.
While EDH totally transformed the clinical work, the management side of things, evidence-based management, it's just moved so much slower. It's kind of strange.
Okay, so that gap. Evidence for treating patients is one thing, but evidence for managing the system that treats them, that's lagging behind.
Exactly.
Right. So as we dive in today, I really want to get into why this difference and, what can we actually learn from it? Maybe let's start with the clinical side first. Why did EBH become such a big deal?
Okay. Well, a lot of it came down to fixing this thing called the research practice gap.
Meaning?
Meaning basically that what research showed was best wasn't always happening in practice. You had good treatments being underused or sometimes useless, even harmful ones being overused or just misused.
Can you give an example?
Sure. Think about pulling out healthy wisdom teeth just in case.
Right.
That was overuse.
Right.
Or maybe routine prostate cancer screening for every man, even low-risk ones. Another overuse example.
Okay.
Then on the flip side, underused, like not giving older folks proven drugs for high blood pressure.
Or help to stop smoking.
Exactly. Stuff we knew worked, but wasn't getting to everyone who needed it. These weren't small things. They had real impacts on health and costs, too.
So EBH was meant to bridge that gap. It was like a huge shift.
A total paradigm shift. It wasn't just about doing research differently, but changing how clinicians found and applied it.
So easier access.
Yes. Imagine going from digging through random studies to having things like online databases, systematic reviews, like the Cochrane collaboration, summarizing the best evidence clearly.
The goal actually became changing practice, not just publishing a paper.
Precisely. That was the game changer for patient care.
Okay, so that makes sense for the clinical side, but now the management lag.
Right. Here's the kicker. Management has the same kinds of problems.
Like what, overuse of fads?
Totally. Think about big organizational mergers that are supposed to improve things, but often don't deliver.
Or those patient satisfaction surveys. Sometimes they feel like busy work.
Yeah, if they're poorly designed, they just eat up resources and don't give you useful info. That's overuse.
It reminds me of corporate buzzwords. Everyone jumps on board without really checking the data. Happens in healthcare management too, huh?
Absolutely. And then there's underuse of good ideas.
Such as?
Like using specially trained nurses or other professionals instead of doctors for certain routine tasks. We know it can work. It can be cost-effective.
But it doesn't always happen.
Right. And you see huge variations in how things are managed from one place to another with no clear reason. Suggests misuse, just like in clinical care.
So why? Why the big difference, the lag?
A big piece is probably culture clash.
How so?
Clinical culture is, well, it's very professionalized. Science is highly valued. There's a shared knowledge base, certain expectations.
Okay.
Management culture, it's much more diverse. People come from different backgrounds. It often values practical experience, maybe gut feeling, more than formal research.
And maybe less connection to the researchers themselves.
Often, yes. And maybe less formal training in interpreting research. Plus, the research itself is different.
Right. You mentioned that clinical research loves those big quantitative studies, randomized trials.
The gold standard. And the results tend to be easier to generalize, stored in organized databases like Medline.
Whereas management rate
Leans more on social sciences, qualitative methods, case studies, interviews. It's valuable stuff, but the literature is way more fragmented.
Yeah.
Harder to pull together clear answers.
That's generalizable, baby.
Often, yes. And then there's how decisions get made.
Okay, tell me about that.
Clinicians make lots of decisions, often quite quickly. For individual patients, they usually get feedback. Does the patient get better? And they have guidelines to help.
Yeah, you wouldn't want your doctor just guessing based on how we've always done it.
Exactly.
Yeah.
But managers, they tend to make fewer but bigger decisions, often in groups over longer timescales.
And the feedback is slower. Less clear.
Much less immediate, yeah. And there isn't that strong tradition of using formal decision aids or guidelines like in clinical medicine. The whole process is different.
It sounds like a tough nut to crack. But are there ways to bridge this gap?
Definitely. There are efforts. A great example is the Center for Health Management Research, CHMR.
CHMR, what do they do?
They started back in '92. It's basically a cooperative, bringing managers, clinicians, and researchers to the same table.
Ah, collaboration is key.
Absolutely. The whole point is to work together to figure out what research questions matter most to managers, do the research, and then critically get the findings out there in a way managers can actually use.
So not just academic papers.
No way. Think short, action-focused summaries, websites, maybe liaison people, things that fit how managers work and the timelines they face. It's about building a culture of learning through research.
Making evidence accessible and relevant.
That's the goal. Broad dissemination, embedding it in practice. And if you think about the bigger picture, using evidence to improve how healthcare is managed. Well, that's just as crucial for the whole system as using evidence to treat patients.
Right. It's not about just forcing the clinical model onto management.
No, it's about adapting the principles, the commitment to using the best available facts for the unique world managers operate in. So, reflecting on all this,
Yeah.
what part of this whole discussion really jumps out at you, listening in?
And maybe a final thought to take away. How could you bring a bit more of that evidence-based spirit, that hunt for the best facts, into a decision you're facing? Could be at work, could be anywhere in your life, something to think about.